Do you have recent onset of lower abdominal pain or side pain that you can't put your finger on in terms of a cause that was physical or induced by activity? I'm talking about pain in the lower abdomen, groin area, down to the side and in the flank. If you have pain in these areas and you can't point to a physical activity induced cause, then you may have a urogenital infection or a UTI. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. In my practice, I commonly get lab results with females that show UTI, and I report that to the individual, and she responds with, "What? But I've never had burning with urination or pain or any of the signs that we learn are indicative of UTI." And over my practice experience, what I've found is I've seen multiple ladies that have not just a UTI, but a significant UTI with bacterial overgrowth of, say, strep or E. coli in the 100,000 counts that were asymptomatic. So lack of symptoms does not mean that you don't have a UTI. But if you do have these symptoms in the lower abdomen, in the side, or in the flank, then, and you don't have a physically induced cause that you can point to, then this may be referral pain from the kidney if it's flank pain, or from the bladder or ureter if it's in the side and or lower abdomen. So what can you do? Well, ideally, you could run a urinalysis with culture to find out, A, if it's present, and B, if it is, you culture it and figure out what the species is so that you then know how to address it. Or if you were going to treat empirically, a supplement that you can pick up easily at Vitamin Shop is called d-mannose, and it's often combined with cranberry extract. And we've used that with good success at our home with our females in our family and with patients. So if you were thinking, hey, I have this pain, I don't have the ability to get the urinalysis or the time, or I just need to treat empirically, then you could try d-mannose and cranberry extract. And if you don't have a Vitamin Shop or don't have that near you, then you could try cranberry juice and see if that helps. Ultimately, you want to get to the cause of why you have the UTI. Many times it can be a pH imbalance in the urogenital system. The more acidic your urine is, the more prone you are for infection and bad things to happen. So you want to be slightly net alkaline there. So alkalizing your urine is a more long-term approach to correcting this. Also, if you have chronic UTIs, they may be driven from poor gut health and gut dysbiosis that then leads to urogenital dysbiosis. So cleaning up the gut could clean up the urogenital system for you as well. All of these things are things that should be investigated if indicated and addressed by a functional medicine practitioner. So if you have a history of chronic UTI, chronic urogenital complaints, then a functional medicine practitioner is one who can help you get to the bottom of it, address it, and not just throw boric acid inserts or topical antibiotics at it.